Welcome to the deep dive. Today, we're diving into a concept that could really reshape how essential information, particularly in healthcare, actually reaches us. I mean, think about your smartphone. It's way more than just calls and texts now, isn't it? It's basically a powerful computer right there in your pocket, a constant companion. And it's become, well, pretty indispensable in the medical world, too. We've seen this huge explosion of health-related apps, right? But here's a really crucial question. In a world that wants instant knowledge, how do we make sure the health info you're getting is, accurate, trustworthy, actually based on evidence? So our mission today is to unpack this really fascinating study. It presents a genuinely innovative answer. It's all about empowering the people who need that reliable health information, the clinicians themselves, to become the creators of it. And here's the kicker. They can do it without writing a single line of code. This deep dive is really about democratizing app development for medical experts, shifting that creative power, from specialized programmers to the clinicians who have the medical knowledge but maybe not the coding skill.
And that's exactly where the core issue lies, isn't it? Our source material really emphasizes the sheer number of health apps out there now. But at the same time, there's this critical lack of robust appraisal. What's genuinely concerning, and the source points this out, is that many app stores just aren't vetting the actual medical content before an app goes live. This creates a massive gap. It's kind of a Wild West situation, actually. It makes it incredibly hard for users, even other clinicians sometimes, to tell what's a genuinely evidence-based tool versus something unverified, or worse, misleading. So it begs the question, if pretty much anyone can publish a medical app, how do we ensure credibility? How do we know it's accurate? That need for clinicians to be directly involved, to really own the content, it's absolutely paramount if we want to build trust.
Yeah, that's a huge vulnerability you're highlighting there in our digital health world. I mean, over the last, decade and a half, we've seen this incredible surge in RegTech. The iPhone launch in 2007, then the App Store in 2008, that really did flip the switch, didn't it? Suddenly, smartphones weren't just phones. They were these powerful handheld computers. And in healthcare, that meant, boom, rapid access to current evidence, instant communication, better organization, all right there. And it's not just theory. Studies have really shown how embedded these devices are. Like there was a 2012 study, Payne, I think. It found super high smartphone ownership among medical students and junior doctors. And they weren't just, owning them. They were actively using 1 to 5 medical apps for maybe 20, 30 minutes a day, using them for crucial things, diagnosis, managing patients, drug references. Then another study, 2014, showed a specific hospital iPhone app actually saved doctors significant time. About 68% agreed. So, yeah, chances are you're already using apps in your daily life and your medical care. It's increasingly shaped by them, too.
Absolutely. It's definitely a double-edged sword, this explosion of digital tools. While these mobile apps offer huge utility, incredible convenience, you've hit on that critical appraisal gap we talked about, it's pretty well known, unfortunately, that app stores don't routinely, rigorously review the medical content before publishing. And that means there's this worrying lack of solid evidence-based backing in loads of the health apps you can just download. Our source actually flags specific examples, areas like asthma self-management, cancer prevention, detection, management, even CPR apps. I mean, if you're relying on an app for potentially life-saving info, you absolutely need to know it's correct. And this really hammers home why getting clinicians directly involved is so vital. If the people who actually understand the medicine, who practice it every day, were the ones creating these apps, well, concerns about the evidence would naturally shrink. Right. But, and this is the big but, how does a busy clinician who likely has zero background in programming or app development possibly create a sophisticated app? That's the real skill gap. That's what needs bridging.
All right, that's the core challenge, isn't it? We need the experts involved, but they're swamped, and they're not coders. So how does this research propose we bridge that gap? It seems pretty wide. Well, this is where our source delivers that real aha moment. The research introduces 2 freely available ways, methodologies, that let busy clinicians develop mobile apps without needing any programming language. None at all. Now, that is a genuine game changer. Because, historically, building an app meant learning complex code, diving into web frameworks. These tools just bypass all that. They let the subject matter experts, the clinicians, directly translate their knowledge into a digital format. Okay, so the first tool they talk about is WordPress. Now, most people probably know WordPress for blogging, right? But it's actually this online open source website creator. It does a lot more.
And its adaptability for clinicians is, well, it's really impressive. Think about a GUI, a graphic user interface, like your phone screen or your car dashboard. You're clicking buttons, dragging things, not typing code. That makes it instantly accessible, really intuitive, pretty much regardless of your tech background. With WordPress, it's genuinely straightforward. You create an account, register a domain maybe, and then just modify the content using this visual editor. You can add text, upload videos or images straight to a library, embed them easily. You can even set up simple questionnaire surveys, and the results, they can get emailed right back to the clinician. What's really smart about WordPress here is its responsive design. It looks and works like a full website on a computer, sure, but pull it up on a smartphone. It automatically adjusts, looking and feeling like a web-based app. That agility, that direct ownership, it's a profound shift.
Okay, so the second tool they mentioned is iBuild App.
iBuild app. Okay, that's another interesting one. Also an online mobile app builder. And it uses a similar kind of user-friendly interface. How does that one fit in? Does it offer something different or complement WordPress? Well, yeah, very similar to WordPress in that its GUI directly supports integrating text videos, but it also easily handles rich site summary or RSS feeds. Now, RSS feeds are particularly neat here. They allow for dynamic content. So imagine the app automatically pulling in the latest research headlines from a trusted journal maybe, or critical public health alerts. It keeps the information fresh without someone having to manually update it all the time. What's really striking about both these tools, like you said, is how they empower the content creators, the clinicians, to use all sorts of multimedia without writing code, zero code. It fundamentally changes who gets to be an author in digital health. It shifts from programmer to practitioner.
Yeah, absolutely. It really feels like moving from just consuming info to actively shaping it. Does this ease of development also mean like faster updates? Could a clinician change something almost instantly if guidelines change?
Oh, absolutely. That speed and direct control. That's central to why these are so powerful. You could have a clinician spot an unmet need maybe for patient education, or a quick reference guide on a Monday, and by Friday, have a working prototype app addressing that exact need. It just bypasses the usual bottlenecks, waiting on IT departments, hiring external developers. It means medical knowledge can get out there much, much faster as things evolve.
That is a powerful idea.
Yeah.
So we've got these tools, they sound intuitive, powerful, but the real proof is in the pudding, right? How did the authors of our source actually use these in a real clinical scenario?
Yeah, they didn't just theorize. The authors actually put these methods to the test. They used them to develop an app called Mastering Psychiatry. It was designed specifically for medical students doing their psychiatry rotation in Singapore. So a real-world tool for a real-world need.
Mastering Psychiatry.
Okay.
Man, what did this app actually do for the students? What was in it?
Well, the WordPress version, the portal, was pretty comprehensive. It had a brand new textbook written to include local clinical guidelines for Singapore, so it's super relevant for them. And crucially, it also had videos. Videos showing how to assess patients, how to elicit specific psychopathologies, really practical stuff for training. Plus, they added an interactive multiple-choice survey for exam revision. The iBuild app version was designed more as a handy, portable clinical reference. It had similar content, but broken down into 4 distinct tabs, just for easier navigation on a phone, on the go.
Right, a really tailored resource for learning while moving around. Okay, so they built it. How did the students actually like it? Did they use it?
The results were actually quite striking. They launched it back on July 15th, 2012. The online portal, the WordPress one, it racked up an impressive 21,991 unique users over time. And the mobile app version, the iBuild app one, had 722 users. But beyond just usage numbers, they surveyed 185 students to get feedback, and it was overwhelmingly positive. Get this, 95.2% found a psychiatry mobile app useful. That's huge. A really high number also specifically valued the textbook content and those clinical OSCE videos, OSCEs, those practical exams. So videos demonstrating skills were clearly valuable. And critically, 71.4% agreed the app would be a good companion to a traditional textbook. That really shows its value as a supplement, doesn't it? And this fits with other findings, too, like Waldman and Weckbecker in 2013. They found students preferred a web-based app for primary care guidelines over physical copies, often using it only at waiting periods, grabbing knowledge on the go. It just reinforces how powerful these mobile learning tools are in modern medicine.
Wow, that student feedback is really telling. 95%. It suggests these aren't just flashy gadgets, they're genuinely useful learning aids.
If you were a med student back then, how do you think having something like that, an on-the-go tool, would have changed how you studied, especially in those unavoidable waiting periods?
Oh, I think it would have been totally transformative, honestly. So much of medical school is about absorbing vast amounts of dense information and then trying to apply it. Having a reliable, concise reference literally in your pocket, accessible during a quick break on the bus. That's just invaluable.
It shifts learning from passive reading sometimes to active engagement right when you have a spare moment. It makes those previously lost minutes really productive. It's not about throwing out textbooks, not at all, but it's augmenting them with immediate searchable access and, crucially, visual aids for clinical skills. That's powerful.
So, pulling this all together, what does this mean for you listening? And maybe more broadly, for the future of healthcare education, even practice? I think the core takeaway is that these readily available no-code tools genuinely empower clinicians to build their own apps. Whether it's for teaching, for academic work, for research, this capability is massive. It directly tackles that critical need we talked about, getting more evidence-based apps out there, or at minimum, apps that have been checked and approved by the clinicians using them. It just elevates the quality, the trustworthiness of digital health information for everyone.
And it does raise that important question, doesn't it? Given how relatively easy and advantageous this seems, why aren't more healthcare organizations, universities, hospitals doing this routinely? Our source suggests that these in-house apps, developed internally, have real inherent advantages. They can target very specific educational gaps or competency issues you see among students or residents. Plus, they're low cost to develop, which is huge in healthcare, let's be honest. They can be built quickly, vital if you need info out fast, maybe during a public health crisis. And they tend to work across different devices and platforms. But, while they're powerful, we need to be critical thinkers here. There are limitations. The number of truly interactive features you can include, it's often limited by what the builder's online libraries offer. So for really complex, highly innovative functions, yeah, you might still need traditional coding. And on another point, these web-based apps, they might not show up in the big app stores like Apple's or Google Play. That can definitely impact how widely they get discovered and used. It's almost like having a great recipe but no easy way to share it, right? That's a perfect analogy.
Yeah.
It makes creation easier, but getting it out there, the distribution, that's still a potential hurdle.
Precisely. And just for completeness, we should also mention the study itself had its own limitations. It was a fairly small sample. And from an Asian cohort, so maybe the findings don't perfectly translate everywhere. And, surveys always have potential biases. But even with those caveats, the proof of concept, the demonstration that no-code app development by clinicians is feasible and useful, that remains incredibly strong. It definitely shows us a potential path forward, even if there are still some bumps in the road. So we've taken a really deep dive today into how busy clinicians, people without coding backgrounds, can actually create valuable evidence-based mobile health apps. Using simple online tools like WordPress and iBuild app, we saw the Mastering Psychiatry app example, how it successfully engaged students, provided that crucial on-the-go learning, and the real impact it had. And this isn't just about the tech, is it? It's really about empowering the experts, letting them bridge that critical gap between fast-moving technology and the urgent need for reliable, properly vetted information in healthcare. It puts the power of creating knowledge directly into the hands of those who truly understand the content, understand its implications. It could fundamentally shift how medical knowledge gets shared and used.
Which leads to a really interesting final thought, doesn't it? Given this speed, this ease, how clinicians can now create and deploy these very targeted apps. How might this shift the balance of power in medical information away from, say, traditional publishers or even the big app stores and more towards individual clinicians, medical schools, hospitals? And what kind of impact could that have on the quality, the accessibility, the sheer relevance of health knowledge for everyone, everywhere? It really makes you wonder, doesn't it? Are we maybe on the edge of a much more localized, truly democratized medical information revolution?